Welcome. It is that time, one time each month, the one place each month that I answer your questions. It is Ask Dr. Geier Live. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injuries. This is that show that I do, and I do two live shows back to back. This first one is where I explain surgeries, injuries, rehab, regenerative treatments, that type of thing. So if you've been having orthopedic injury, knee, shoulder, hip, foot, ankle, whatever, I am happy to talk about it, talk about treatment options, talk about surgical options, rehab options, that type of thing. Very excited to do that. As always, I am not giving you specific medical advice. I haven't seen you, I haven't examined you, I haven't looked at x-rays, MRIs, that kind of thing. So I am just giving you general information, educational purposes only. So hopefully this is your opportunity to maybe ask a question. Then you can ask better questions to your doctor or orthopedic surgeon, or if you've already seen an orthopedic surgeon, take that information, ask me, and maybe I can translate that into plain English. Please understand that. Also, if you have a question, leave it in the chat on YouTube, not in the comments below the video. I cannot see the comments. I can only see the chat. So if you see like Kaylee Chapman, I'll just post it. I'll take it off. I'll answer your question in a second, Kaylee. But if you can't figure out where the chat is, look for that. It's usually at least on desktop on the right side of the screen, and enter it there. The chat comments, I can see the comments under the video. I cannot see. Every time at the end of the show, I'll go on to YouTube because I'm not actually on YouTube now. I'm in a service called Ecamm, and I'll see people left comments and then I didn't see them. And I greatly apologize for that, but the chat is the only place that I can see those. Also, if you are a military veteran here to ask me a question about your disability claim, I am very happy to answer that, but that is not what I do in this show. I do that in my 5:30 show, Veteran Nexus Letters Live, on my other YouTube channel. Just search YouTube Veteran Nexus Letters, Dr. David Geier, you'll see it. There'll be a live show and I will answer those in my 5:30 show. I just want to keep this for people that have questions about their injuries and potentially what those injuries mean, surgeries, that kind of thing. Also, when I talk about regenerative treatments, which this isn't always about regenerative treatments, sometimes people just have questions about their injuries, but if we're talking peptides or exosomes or stem cells or anything like that, I am not promoting them, I'm not pushing you, I'm not telling you to do them. Any of these off-label or experimental treatments that are not approved by the FDA, I am just giving that information for educational purposes only. So Modi, yours would be a good example. I will, if you come to my show at 5:30 on the Veteran Nexus Letters channel, I will be happy to answer that for sure. All right, Kaylee Chapman, very cool. I always love it when people give me their names and not some other name. I always like to put a name to a face. I'd also love to know where people are from, state, that type of thing, or from another country. That's always cool. Anyway, Kaylee says, my orthopedic surgeon wants me to try hydrotherapy and a TENS EMS machine, and if that doesn't work, I have to go to a pain clinic. What are your thoughts on pain clinics? It depends, and let me. She's got a follow-up question. It's the same one. It depends. I don't know that pain clinics, just as a general thing, necessarily good or bad. People ask chiropractors, do you agree with people going to chiropractors? Not, and it's not that straightforward. I think a lot of it depends on the individual practitioner. It also depends on what the diagnosis is, what they're trying to do. I think there's a number of orthopedic conditions, a number of spine conditions with neurologic components that there isn't necessarily a great surgical option. Not a great decompression or stabilization or whatever it is surgically. And when there isn't a surgical problem and it's just pain, this is a generalization, but generally surgery has very, very bad success rates when it's just pain, but there's not something structural to correct. And so in those settings, a lot of times pain management can be a better option, whether it's nerve blocks or any number of other modalities to try to get pain under control when there's not something structural that can be fixed. Kaylee, that is a huge oversimplification. I completely admit that. but that would be my answer. In general, for that type of thing, I think they can do very well. But again, it depends on the problem. It depends on the practitioner and the options. And I wish it was I had a little bit more straightforward of an answer there. SH writes, in my ebook, if you don't have it, the arthritis solution, which is about way more than arthritis, by the way, are they listed in order of effectiveness? No, they were grouped in order so they were generalized into categories. Peptides, more regenerative treatments like exosomes and that type of thing, supplements, that kind of thing, not in terms of effectiveness. In general, and everybody feels sort of different about this, and this is not a rule of thumb, but I typically start more conservative and work to more aggressive, but it depends on a lot of different factors, but that's just generally because I'm fairly conservative in nature. But I have a lot of patients that throw everything at it all at once. They want to go at it, full scope, and so everybody's a little bit different about that. But that ebook was written not in a most effective to least effectiveness, because again, it's not just for arthritis, it's for all sorts of orthopedic injuries, and so different things would be better for different problems. Interesting question though. And Stuart says he's from Costa Rica. I love Costa Rica. I have spoken at conferences there 2 or 3 times, and I've gone 5 or 6 times. One of my favorite places in the world. A very, very cool place. Where are we here? Gabriel Giordano, very cool. I've been diagnosed with osteochondritis dissecans on the edge of the left femur with some cartilage damage. The bone has healed substantially. I'm now 21. Can I still heal completely? Here's the general rule of thumb. Well, before I get to the general rule of thumb, for the people that don't know what osteochondritis dissecans is, and it's typically of the knee. You can get it in the elbow too. In theory, I guess you could get it in the ankle, but what happens is, and it's typically the inside, what we call the lateral aspect of the medial femoral condyle, so it's right there where the cartilage stays intact, but the bone under it starts to die for some reason. It can be trauma, it can be vascular, it can be overuse. If you catch it in a kid before he or she, and it's more common in males when I say he, but you can get it in females, but before that child stops growing, if you make him or her completely non-weight bearing, very often you can get it to heal. That's assuming the piece hasn't detached and it's not floating free. Again, that's when the child has open growth plates. Once those growth plates close, that lesion doesn't typically heal beyond that. Now, it doesn't necessarily mean it's going to fail, break off, and you're ultimately going to need surgery, but statistically, once somebody has finished growing, if that OCD lesion has not fully healed, eventually it tends to die and break off, and you need to do a bigger surgery, whether that's transferring cylinders of bone and cartilage from another part of the knee or using a donor bigger cylinder of bone and cartilage, something like that. There's some other options too, but it typically requires surgeries. Not to say that it always wouldn't need surgery, but the rule of thumb is typically once you're done growing, and presumably by 21 somebody's done growing, very often needs surgery. Let's see, Anticus Jones, where are we? I broke my right wrist scaphoid twice in 8 weeks. Gee whiz. That is terrible. Several weakness, pain, spasms, tried therapy, brace, little or no relief. Scaphoid fractures, so I don't know how well you can see. Let me do it in relation to so at the base of the thumb, like if you sort of pull your thumb away, you see those tendons right in that's called the anatomic snuff box. If you push right between, let's see where I can do, right there, between those tendons and push deep, that's the scaphoid, and that bone does not heal very well if it's broken. And it's got a very poor blood supply, and goes on to non-union very frequently, and then once that happens, you get collapse of that bone and very significant arthritis. So again, without seeing x-rays or further studies, CT scans, my gut instinct is 2 scaphoid fractures. That's probably something that needs surgical treatment. Again, that's not advice because I haven't seen your studies, but the long-term complications of a scaphoid fracture are pretty great. Now, if it is a perfectly lined up scaphoid fracture in a specific part of the bone, you can treat it in a cast and it conceivably can heal. 2 fractures, I'd be a lot more nervous about that and long-term issues with that. All right, Mike says, Dr. Geier, insertional Achilles tendinopathy for 4 years. Choice between PRP, stem cells, or exosomes. What do you choose? So there's not a right answer. And this is, Mike, there's going to be different opinions with a lot of regenerative people. I've not been very enthusiastic about platelet-rich plasma from having done it for so long in traditional orthopedic surgery, which I did for 16 years. The data, the studies are not that good for it, and I didn't have that much success with patients with it. It's not to say that it doesn't work, and it's the cheapest of the 3 options, and if it works, fantastic, and it's coming from you, which is conceivably good. Now, there is a way to do exosomes where that comes from you as well, but most people that do exosomes do it getting it from umbilical cord, amniotic fluid. Stem cells, both of those are considered experimental in the United States. Stem cells, if you're getting it from the patient, one of the criticisms of stem cell studies in the United States, say like if you get bone marrow from the hip from somebody 40 and older, there aren't that many living stem cells in the United States, and you can't go on and replicate that. So autologous stem cells, meaning from the patient, for that, probably not all that effective. If you did stem cells from, again, amniotic fluid, umbilical cord, maybe more effective than that. Exosomes, I think, sort of overcome that risk. But the nice thing about exosomes, there's no DNA and things coming from another person. It's just the exosome itself, which is thought to be what does the work of stem cells anyway. So I like exosomes, but that's not to say that one is absolutely right and one's absolutely wrong. With stem cells, there's other factors. If you're going to other countries where they have more options than they do in the United States and things like that. So there's a lot of variability to that. PRP is the most accessible to most people. Almost all orthopedic clinics in the United States have PRP. The others you don't have nearly as much access to, and you have to go to a regenerative specialist because those typically are not done in hospital-based practices, academic practices, things like that, because they're experimental and not covered by insurance. So a lot to think about. I wish there was an absolute right answer, but that's kind of what I think. Mike, I have an exosome treatment scheduled for November. Make sure it's the right choice. I think exosomes can be great for a lot of reasons. I definitely don't. Again, this is not medical advice, but I definitely don't discourage that for lots of orthopedic problems. My knee was injured 2 years ago, tibial plateau fracture. Should I still walk with crutches? Will I have pain when walking in the future? It depends. Typically, the non-weight bearing time with a tibial plateau is somewhere between 6 and 12 weeks, but it depends on where in the tibial plateau it's broken. Was it lateral? Was it medial? Did they have to fix it with plates and screws or some other device? Is it healing appropriately? Does it extend into the joint? Lots of different factors with it, and so that's hard to say, but once it has shown signs that it has healed or is well on its way to healing, typically weight bearing is okay. And again, that's usually somewhere 6 to 12 weeks. Typically people err on the longer side than the shorter side. Kaylee says, what would you say? Severely truncated acromion, running out of pain options, severe muscular atrophy where all my bones are sticking out. I can't say that I understand what that is. So the acromion is the tip of your shoulder blade right there. I'm not 100% sure necessarily what that would mean, a truncated acromion. I would be hesitant to think that's the cause of the symptoms. There is something called os acromial, where there's a growth center of your acromion, and in some people it doesn't fuse. There's been a lot of debate over the years about, is that actually a diagnosis that you should treat, because is it the source of a patient's pain versus something inside the shoulder. I don't know with the muscular atrophy, that really complicates things. I can't say that I have without knowing more, that I have a lot of insight as to necessarily what the options would be. I mean, yeah, obviously you got the physical therapy that I'm a big fan of. There's a variety of different traditional injections and regenerative injections that I do, but I don't have a good sense of what the next step is. I apologize, Kaylee. Without knowing more, I don't have a great answer. And then Mike says, last question about stem cells, exosomes, any risk? I've heard they can cause tumors, immune problems, evidence. I haven't seen anything that worries me about that. There is that thought with stem cells because there is DNA that maybe there's a tumor risk. I don't think that's a significant risk, honestly. I just like exosomes because there isn't any of that. But I would worry more about just anytime you do injections, there's risks, infections and otherwise, albeit exceedingly low. But those would not be the risks. The immune reactions and that kind of thing, I don't expect would be risks either, quite honestly. I see what Kaylee's talking about. I cannot pull her comment up. There we are. So in prior surgeries, it looks like they've taken too much away. Yeah, that's one of those sort of no-nos, and I'm not saying that it was malpractice by any means, but yeah, that can be a real problem when they've taken more than they should. And over the years, even in the time since my residency training and then through practice, we've really cut way back on how much of the acromion we shave down because we know really that's not the source of the problem. If you look at rotator cuff impingement or even partial tears, it's the undersurface of the rotator cuff where the tear is, not the surface that's up against the acromion. And so we've really gone way back trying to minimize how much of the acromion we take away. What you do after that is really tricky, though. I don't know if that's something that bone grafting would be beneficial. That can be a really tricky problem. And then our Costa Rica friend, 2 supplements I tried for a few years, NAC for the lungs and NMN. Yeah, I don't have a lot of thought on either of those. When I did my anti-aging and regenerative medicine boards and the year of studying for that, they talked a lot about N-acetylcysteine. I don't use that a lot with patients. NMN, sort of a precursor to NAD, there's a lot of conflicting literature. I know David Sinclair is a big fan of that. I think there's some debate about it. I know that NAD is a wildly investigated and a very popular thing that people are looking into for longevity and energy and a variety of other things. I'd love to hear your experience with it. I don't typically use it with my patients. To be fair, when I did my anti-aging and regenerative medicine, I decided pretty quickly after that to focus mostly on orthopedics and not so much hormone replacement and all sorts of medical problems, neurology and everything else, oncology and things that I had to learn for it. So I have not kept up with some of that as much as I should. I focus on sports medicine performance and then obviously regenerative treatments for me. All right, it looks like it's it. Very, very good questions, variety of subjects this time. So and he's saying it helped his arthritis pain. The N-acetylcysteine, I think that makes sense. I can't say that I know that NMN would necessarily do that, but I don't have any downsides. There's a lot of supplements. Maybe we'll talk about that in a future show. A lot of supplements that I like for orthopedic issues. But great questions. I will be back here Monday, November 3rd, first Monday of the month of November. Very much look forward to seeing you there. As always, get a copy of my arthritis solution. There's a link in the description under this video that takes you to the contact form. You can get all that. Also, if you want to see me as a patient, there's information about how you could talk to me about potentially doing that as well. Thank you so much. I really appreciate you being here, and I will see you right here next month. Take care.